Hi everybody. I've got Jeff here face down. Is that where it's tender? Go ahead and find it. Yeah, right there. Okay. So I know you all have seen us do some fancy things right in there.
Yeah. Right.
Yeah. So we dry needle, we do laser, we do ultrasound with stim. But this is just an old-fashioned, what I call acupressure technique. This is right where his piriformis comes over and a little bit of his glute minimus and maybe part of his glute med. So I'm just going to take my elbow and find that spot, okay, and you relax for me. And I'm just going to gradually put some pressure on this, Jeff, okay? You okay with this?
Yeah.
You feel that?
Yeah.
Yeah. Do you have any pain radiating down your legs?
Not right now.
Yeah. So a lot of times we'll do this if we have what's called a piriformis syndrome, and the piriformis muscle runs from the sacrum and attaches over on the greater tuberosity, and the sciatic nerve runs underneath that muscle most times. And if that muscle gets tight, it can put pressure on the sciatic nerve, and the individual would have some pain or numbness down the leg. But I'm not doing that right now. I'm right on that attachment, okay? You good with me?
Yeah.
Yeah. So once I get on it, I like to hold it for about 10-15 seconds. And what you should feel is eventually it start to let go a little bit, and the pain should diminish a little bit, right?
Yeah.
And then when we're done, we're going to do a little bit of what we call active release on it. We're going to pin that muscle, and then we're going to stretch it out for you, Jeff, okay?
Okay.
And then we'll adjust you, all right? So I'm taking my elbow and I'm following along the greater tuberosity and rolling right up on top of it. Is that any more sensitive or less sensitive?
That's more sensitive.
It's more sensitive right there, yeah. See, I'm getting on top of that now a little bit, okay? So your back feels better though?
Yeah.
Yeah. So he went through some dry needling for his back that helped that. You feel that right there?
Yeah.
Yeah. Any pain right down your leg at all?
No.
Any pain radiating anywhere else besides right where my pressure point is?
Straight. It's localized.
It's localized, yeah. Great. Okay. Relax now. So you rest there for a second. I want to get some help. Hey, Jonathan, will you help us here, please? So we're going to bring Jeff back up. So just tuck your toes in, Jeff. Find the bottom of that table. Everybody, this is Jonathan.
Hey
This
guys.
is Jonathan's last day in the office, Jeff. Did you know that?
I did. Yeah.
Yeah. So I'm gonna reach in front of you and make you a little taller. These tables are magical, and I want you to turn on your side facing this way. Jonathan, tell everybody where you're going.
I'm going to chiropractic school, Logan in St. Louis.
Whoop whoop.
Yeah.
We're gonna just bring his slacks down a little bit to get a contact. So Jonathan, I think, will be number 5 actively in chiropractic school right now. I'm not talking about all the people who have come in the past, Jonathan. There's probably about like 6 to 8 people out there that are chiropractors right now. And your buddy's going with you, right, Sebastian?
Yeah, Sebastian is coming with me.
And then
Jeffrey,
so
let me bend your knee.
you relax. Okay, so go ahead. So we're going to get a little bit of that piriformis all the way up. Keep going. Now drop his knee down. There you go, Jonathan. And drop that leg down. You've done this a few times, haven't you,
I
Jonathan?
have.
Yeah, he's got great hip mobility there too. Come on back up for me. So I'm not gonna let him cheat so much. I'm gonna hold him back a little bit more.
Mm-hmm.
So go ahead. So I'm right on the piriformis. Go flexion, knee flexion. Keep going up high, keep going right there. And I can feel that tension. Drop his knee down. Yes, that's better. There we go. Good. Back up again.
Mm-hmm.
Let's do it again. Go ahead. You all right, Jeff?
Yeah.
Keep going a little higher with flexion. Keep coming. Right there. Bring him down. Good. Drop that knee down. All right, so now we're going to do his glute med. This is a little bit more of a complicated movement pattern, okay? And so we'll work together.
Mm-hmm.
And so here's his iliac crest right here. That's where his hip joint is. The glute med and runs down this way. The minimus is underneath and it runs down this way. So go ahead, Jonathan. Let's bring him into. We're going to bring him into flexion, and then we're going to take his knee away from midline or abduction, and I'm going to contact that glute med. Give me a little bit more flexion, Jonathan, please. Right there. We lock the muscle or pin the muscle. Go ahead, take him into extension. Keep going, keep going. I'll drop him into adduction, bring his knee to the floor, and then straighten that leg out a little bit, John, if there's anything left in there. Good, beautiful. Do it again for me.
Yep.
Jeff, I'm going to just put you right there again, okay? So again, we go to hip flexion, we pull his knee away from midline or abduction, a little more flexion, pin the muscle down, go ahead, all the way down. Take it back into extension, hip extension, adductum, beautiful, beautiful, gorgeous. Now straighten his leg out, right? And then I'm going to step out for 1 second. Have we showed you the hip exercises we do at all?
I don't think so.
Let's while we're here, let's go over through your favorite
The 7 series?
Yeah, 7 series, yeah. Okay.
Sure.
Yep. And we'll come back and when you're ready, we'll adjust them.
Okay. So we're going to just stay in this position here, Jeffrey.
Okay.
I'm going to get this pillow for your neck so you're more comfortable.
Okay.
And so I'm going to show you 3 different movements that you can do in this one position.
Okay.
First one, you're going to have your legs fully extended for me. You're going to bring this leg up to my hand, pause, turn that toe to the floor, and then now back down to the starting point. And then right when you touch, right back up to this point to my hand. And then repeat that about 8 times. Exhale on the way up. Really focus on squeezing here when you raise that leg up. Good. So we'll do 5, we'll do 2 more. So this is part of our 7 series, guys, that we do in the office to strengthen specifically the glute max, glute med. Just doing abduction right now, really targeting those muscles here. And so now we're going to keep that leg up right there, and then second motion, you're going to kick towards the wall, keeping the leg straight. Beautiful. And then come back to that midline. Less of that extension going forward. Just pause, keep going. Right about there. Good. And then come back to midline. So the reason I just kind of minimized that range of motion for him was at a certain point he wants to use his back to get more range of motion to get to that end point. So we're really focusing on just using the hip muscles. You should by now feel a little burning sensation here, Jeffrey. Good. And then 1 more forward, and then we're going to do 1 more going back. So 5 now from the midline, kicking back towards me. It's a little harder without using or extending their back, so we'll be a shorter range of motion. Really focusing, squeezing here, keeping that toe pointed down, back to midline. So in a continuous cycle with the first 3, you're definitely going to feel a lot of engagement here. It's going to be almost humbling because when you get to like the 3rd or 4th rep of that, you feel that burning sensation.
Yeah.
Good. Let's do 1 more. Perfect. So take a rest. How'd that feel?
Good. It feels tired, but yeah, it feels
Right?
good.
Yeah, it's a good fatigueness that you get.
Yeah.
Just think if you do that daily, increasing your reps each week, then you're really going to help strengthen those muscles to less compensate with other muscles. So we'll just hang out for Dr. Jeff for the best part, which I'll be able to do in 3.5 years.
Well, I guess license. You can do it now.
Well,
One or
yeah,
two,
that's
yeah.
true. That's very true. Licensed. Good point. Because at school, our buddies will definitely be blasting each other.
Yeah.
Like Sebastian and I. You guys know Sebastian. We're going to be roommates out there. So lucky to have him as my roommate. It's gonna be a good time.
Damn. Is this like downtown St. Louis or is it outside?
No, it's on the outskirts, like Chesterfield, so it's not in the city. It's like really comparable to Baltimore. I've been hearing. Like you know, you have your city, you have your good spots, you have your bad spots, and
Yeah.
but we'll be near the school, which will be safe.
Yeah.
Did you get the memo for the Ravens gear today?
I kind of knew about it, but I was wearing it for personal reasons too. So.
Okay, nice.
So.
Yeah, today's
Yeah.
Thursday Ravens in the office, so you probably have seen a lot of people wearing Ravens gear, and Jeff right here is also wearing a Ravens shirt. Let's go see where Dr. Jeff is.
You should finish up really having to stabilize so you don't kind of fall towards the end.
I feel it like here and here.
So how'd that feel?
Good.
Yeah. So I want you to start doing those exercises, okay?
Okay.
And bring this arm up like this. And let me have this. And I'm going to show you another stretch before
Okay.
I leave. So now we're going to adjust his low back, his sacroiliac joint. So relax your shoulder down. Take a nice deep breath in and let it go. Hands up high. Beautiful, Jeff. Other side for me. Come on over. Is that comfortable, Jeff?
Yeah.
Yeah. There's no pain associated with that, is there?
No.
That was the right answer, wasn't it? I think that's probably people's biggest fear, right? It's the fear of the unknown when you go to the chiropractor. What are they going to do? You know,
Yeah.
That's one of the reasons why we do these videos, to eliminate that fear, right? Yeah. And I think the take home is I want you to do those exercises, okay, at home. Let that loose for me. On your back for me. So now I'm going to adjust his hips. What you're going to feel, and you've had this done before, right?
Yes.
Where the one bone is going to feel like it's coming apart a little bit and it slides right back in, right? Yeah. Sort of resets that hip joint. Slide up a little bit more for me. Up the other way, up the other way. Now let your leg loose. There we go. Good. Now, I want you to bring this leg into a 90 position like this. I want you to wrap this leg around it like this. And I want you to, so we're going to stretch it both ways.
Okay.
This is a yoga pose on his back. It's called pigeon. So you bring your leg up like this. And you could take a towel or hold your hands. You're pretty flexible, so reach up and grab just like that and hold it in. The other thing you could do, Jeff, is you could get on the ground up against the wall.
Okay.
And I like this better because let your hands go. And then the idea to increase tension is you slide towards me.
Okay.
If you did that, it would feel like this, right? And what I really like about this is he can just sit there and relax and focus on breathing. I want you to stay here for 2 minutes, and then I want you to rest for a minute, and I want you to do it again.
Okay.
And I know I'm stretching the opposite side up, but this is the position I want you to stretch in, okay? And then he's so far progressed. Next time he comes in, we're going to show him how to do pigeon on your stomach, okay?
Okay.
All right? Good. So straighten your legs out for me. How's your neck?
Next one, fine.